This presentation examines autism and addiction disorders. Here, we are going to look at the relationship and effects of autism on drug abuse and behavioral addictions like pornography, gambling, food, and internet or social media addictions, amongst other kinds of addictions. The presentation is a reflection of the need to appreciate the issues in proper perspective with a view to understanding some basic approaches for managing these addictions. The other sense in which this presentation is key is in the fact that victims of autism are at a very high risk of substance use and other behavioral addictions. We will proceed with a brief working explanation of autism and addiction disorders. Autism is professionally known as Autism Spectrum Disorder, ASD. It is a severe human neurological and developmental disorder that affects the ability of the individual to learn, to communicate, and perform normal social functions due to impairment of the nervous system. On the other hand, addiction is a degenerative biopsychosocial disorder bordering on obsession for substance use or abuse and/or addiction to certain behavioral patterns or behaviors like sex, eating, shopping, gambling, and exercises, amongst others. Victims of autism are usually excessively obsessed, fixated, anxious, hyperactive, impulsive, and repetitive. Their nature makes them slow learners due to attention deficiency hyperactivity, and they are often erratic and unemotional about others. Autism may manifest as early as age 3 in a child, or perhaps even age 2. Besides pre-genetic disposition, a number of factors have been implicated in autistic disorder. The U.S. Center for Disease Control and Prevention, CDC, posits that autism results from differences in the human brain. Other studies, however, indicate that the risk factors for autism include birth complications, fraternity with other family victims of the disorder, factors such as maternal use of narcotics during pregnancy, exposure to harmful pesticides by pregnant women, premature and low birth weight, poor nutrition during pregnancy, and immune system complications may be other risk factors for autism. Key autism statistics and facts made out by Stephen Zodera show that 1% of every 100 persons in the world suffer from autism. The global average for autism, therefore, stands at 83.2 for every 10,000 children, and it is prevalent among every ethnic group on Earth. Research is also indicative of males being more prone to autism than female. But as contemporary findings have presented, there is possible connection between autism and parts of the brain receptors that trigger substance use and other behavioral disorders. It follows that victims of autistic disorders have personal regulation problems. Now, this makes them susceptible to self-medication, which may lead to drug abuse and could escalate to substance use disorders. Now, what is more, the fact that autistic disorder may manifest in obsessive-compulsive disorder could make victims susceptible to addiction. That may also explain why about 78% of victims of autism involved in substance abuse suffer from co-occurring mental and other health issues. The indications that an autistic person is suffering from drug and other addiction disorders include: number 1, lack of focus; number 2, depression; number 3, sleeplessness; number 4, irritability; number 5, susceptibility to anger and aggression; number 6, self-isolation; number 7, lack of interest in social matters generally. Other indicators are truancy, dirty habits, weight loss, and dilated pupils. At this point, it will be quite valid to ask what can be done to help victims of autism and addiction disorders. To begin with, autism, as it were, is not a condition that can be medically cured. However, some of the health issues associated with it and addiction disorders can be treated and/or effectively managed. There are a number of approaches for providing care for victims of autism and addiction disorders. The first best practical approach is to show them love, and it has to be sincere love with empathy. The next step is to seek the help of specialists, especially development pediatricians and neuropsychiatrists. These experts can conduct screening. They can also carry out examination and prescribe appropriate medications for the treatment of the symptoms and prefer therapies for the victims. Therapies in this regard may include cognitive behavioral therapy, counseling, relaxation exercises, medical detoxification, and group therapy, amongst others. Finally, conscious and deliberate efforts must be made to keep alcohol, tobacco, and other medicines away from autistic persons. We hope you have found this instructive. Thank you for watching. Please like, share, and subscribe to our YouTube channel. You can also follow the African Council on Narcotics on Facebook, Instagram, TikTok, and X.